Ever push yourself, like really push yourself, and wonder what's going on with your heart?
Yeah, me too. Well, turns out there's a test for that. Welcome to the deep dive.
Today, we're all about ergometry.
Ergometry.
Yeah. Not as scary as it sounds.
Right.
Basically, think of it as a kind of a stress test for your heart, but way more in depth.
Right.
But before we dive into all the ins and outs and what it all means, let's bring in our expert to help us unpack it all.
Happy to be here.
So what is this whole ergometry thing anyway? Break it down for us.
So ergometry, you can think about it like it's like giving your heart a report card, right?
Okay.
While it's working out.
Okay.
But instead of, building muscles, we're measuring exactly how your heart handles exercise.
Interesting.
And we can see things like your heart rate, your rhythm, how well your heart is pumping, all that good stuff, all in response to like different levels of, physical stress.
So it's not just like a pass or fail kind of a deal. We're getting like personalized info from this.
Yeah, absolutely. It's completely tailored to you.
Okay, that's cool.
This report card, it basically helps your doctor really understand your heart's own unique capabilities and limits. It's incredibly helpful both for people with, existing heart conditions,
Right.
but also for those marathon runners out there.
Okay, so all right, so two very different types of people who can benefit from this.
Yeah.
So why would someone actually need this test? Like who should be calling their doctor right now to book this?
So two main groups benefit from it.
Okay.
First, people with existing heart conditions or if, there's a potential for a problem.
Okay.
This test, it's like a window into how well treatments are working.
Right.
Like, are the medications actually doing their job?
Yeah.
Does a procedure, need tweaking? This test can guide some really important decisions about your care plan.
So it's not just exercising and avoid. It's like giving your doctor information
Exactly.
to then help you make the right decisions about your health.
Exactly. Now, on the flip side, those athletes and really active people we were talking about.
Yeah.
They can really use this test to up their training. You can almost think of it as like unlocking your heart's full potential.
I like the sound of that.
Yeah.
So it's not just for people who are worried about their hearts. It's like anybody who's really active and wants to get better at their sport or whatever they're doing.
Yeah. Like, think about a marathon runner. They could use this test to really understand, how much their heart can handle, before they hit that dreaded wall during a race.
Right.
And then even beyond that, we can use the data to personalize their whole training plan. Like, are they pushing too hard, not hard enough? We can figure that out.
Find that sweet spot. All right, so I'm ready for my close-up. What's the actual test like? What can somebody expect when they go in for this?
Okay, so it's definitely more chill than, your average gym session, so don't panic.
Okay, good.
We're going to put some electrodes on your chest. They're just stickers.
To track your heart's activity.
Mm-hmm.
And then a blood pressure cuff on your arm, standard stuff.
Uh-huh.
And then we've got two options. A stationary bike or a treadmill.
Okay. Oh, okay.
Whichever one you're more comfortable with.
And then what? Then the real fun begins.
Then we start, and the intensity it increases gradually. It's like levels in a video game,
Ah, I like that.
Your heart needs to level up through each stage. The whole thing usually takes around 30 to 45 minutes.
Yeah.
But it can be shorter.
Shorter, really. Why would they stop the test early? Asking for a friend, of course, who might not have the best endurance.
Well, listen, safety is always number one.
Of course.
So we're going to stop if there's, any cause for concern.
Okay.
Or if you hit your target heart rate, it's not about pushing you to your absolute limit. It's about getting the information we need, safely and effectively. Okay, that makes me feel better. Now, our research mentions a couple of other tests. Things like stress echocardiography and then something called like coronary CT angiography.
Yeah.
What are those and how do they compare to this ergometry test?
Yeah, so sometimes your doctor might want a even more detailed picture of what's going on, inside.
Okay.
So think of those as using different lenses to examine your heart.
Okay. Yeah.
Stress echocardiography uses sound waves, so ultrasound, to actually visualize your heart while you exercise.
Oh, wow. Okay.
And then that coronary CT angiography that uses dye and x-rays to get super detailed images of the arteries around your heart.
Oh.
So they each have their own strengths and weaknesses. The best one really depends on what we're looking for.
So it's really up to your doctor to kind of decide what's best for you.
Right, exactly.
But let's talk about everyone's favorite topic when it comes to medical stuff. Risks.
Mm-hmm.
Is this dangerous?
Okay, first of all, it's super safe, especially in a controlled environment. You're with medical professionals.
Right, right.
You might feel your heart racing, of course. You're exercising.
Right.
You're probably going to be breathing hard. You might feel a little tired afterwards. That's normal.
Right, makes sense.
Serious complications, though, very rare.
Oh, good.
Like, incredibly rare. And again, the medical team, we're trained to deal with any situation.
Okay, that makes me feel better.
Yeah.
Now, any tips on what to wear?
Comfort is key.
Okay.
Wear comfy clothes, supportive shoes, like you're going for a brisk walk.
Okay.
Don't eat a huge meal right before the test.
Okay, makes sense.
And guys, if you've got a lot of, chest hair, a little trim might be needed
Oh.
for the electrodes.
The things we do for science.
Exactly.
So, to wrap things up, what's the one thing you want our listeners to remember about ergometry?
I think the biggest thing is that this test, it's a tool, It helps us understand and take care of our hearts. Whether you're an athlete pushing your limits or, just someone who wants to be proactive about their heart health, this test gives you the information you need to, really make good decisions about your health and your training.
So this deep dive really helped us understand like the what, the why, even how to prepare for ergometry. But I want to hear from you. What questions do you have about your own heart health journey? Write them down. Don't be afraid to talk to your doctor about them. They're your best resource.